you can find from the middle towards the internal part. Usually it's more found, more commonly going towards the nasal septum.
But usually here is provocation of migraines, like main indicator of provocation of migraines, headaches.
Yes, this is what usually more here for the emergency of the trigeminal nerves here. So this is more like here, more close to the process muscle. You know, this is more muscle here, the process. And here one of the main indications is headache, migraine. For this one. Headache, migraine, migraña, pain behind the eyes as well. El dolor detrás del ojo, retrocular. So you can check with the fingertips and then the treatment is done. And she has a little bit this point. Feel pain here?
Sorry. Para el desprendimiento de retina ha mantenido.
Many times the pain is felt behind the eye. Now, if the patient has migraine again, we can palpate this spot, but we cannot start from here. Migraine usually starts from the segment thorax up or upper limb. We never start from the area of the. Usually, if I treat patient for migraine or TMJ, I start to treat the area of the face in the third or fourth session. The beginning is like thorax. I arrive till the neck. This already decreases more than 50% of the symptom of the patient. And then in the following weeks, you approach more close to the head. Because the head has also specificity of treatment, we have to balance very well both sides. Like TMJ. Maybe TMJ, if the symptom are only one side, but you need to treat the contralateral side. Because otherwise you don't have a balance, you can actually worsen the patient. So you have to pay a lot of attention. Treating patient with migraine, you have to balance very well the area of the neck first. Because if you treat only one side, you can make the patient worse. Because you activate the migraine. This you have to pay a lot of attention about. So work the first session the thorax, scapula, bilateral, and then you approach more close the head on the third or fourth session. Okay? So, non se tratta, con primera sesión, non se tratta la cara, la cabeza.
¿Primera sesión?
Primera o segunda sesión non se tratta.
Qué bueno, no sé.
Eso stavo dicendo in inglese che se empieza il trattamento del tórax, cuello, se termina el cuello, se balanza muy bien bilateral, okay? Y solo en la tercera o cuarta sesión se empieza a tratar. Bien, perché se no se empeora el paciente. Because if the patient have all the point positive in the okay, all the positive point in the head, because to have migraine, chronic migraine is not just one point. The patient probably have all the point positive, el cuello, la cabeza, todo. So if we only treat few points here, si tratamos solo una parte del punto del cuello derecha, se empeora el paciente. Todos los otros puntos que son activos, que no trataste, se despiertan. So it's like if you take just few points here, what happens in the following days, the point on the other side of the head, which are active but you didn't treat or palpate, they will be more active. So you can make it worse. So it's more, make much more sense to treat first the thorax region, neck region, for the first 2-3 sessions, there is already improvement, and after you go to the head. Prima dos tres sesiones se trata el tórax, el cuello, y después se va a la cabeza. And this also respects the fascial anatomy, because the way you will see in the book of Carla, that example, in the head we have two types of fascia, Galea capitis and epicranial fascia. The epicranial fascia is the real deep fascia. However, most of the researchers and anatomists, they define it as part of the cranium, the pericranium, because it's a very fibrous membrane connected to the scalp and does not have so much innervation. The other one, after speaking Spanish, the other one is Galea capitis, which is a superficial fascia, but very thick and rich of receptor. These Galea capitis connect with the superficial fascia of the head that some researchers call SMAS, which is superficial muscle aponeurotic system, which is the superficial fascia of orbicularis oris, frontalis, part of the temporalis, which is also superficial fascia, and all the mimic muscle. Those is all connected with the galea capitis, connect with this galea capitis, connect with this superficial muscle in the face, is connected to the platysma, and then connected to the superficial fascia of the thorax. Posteriorly, this galea capitis connect to the ligamento nuchae, the ligament of the nuchal region. Okay? And the nuchal ligament is an area of attachment also of the deep muscle, such as the spine. So basically, all the tension that comes from the thorax, the neck region, through the nuchal ligament, they go to the galea capitis and activate. So most of the time, you have many cases of migraine that the patient, like several went for many years in treatment with a neurologist, unfortunately, maybe with medication, with minor improvement. And basically, most of the time, what happens is that the problem is in part tensional, because right now there is, in literature, there is a clear definition between migraine and tensional headaches. But in the latest year, there are a lot of research that question this one, because most of the time, now we know that patients with migraine have limitation of range of motion of the neck, especially rotation and flexion extension. Okay? This is why we use also the test for the rotation, the FRC test, the function rotation test for the migraine. And what happened clinically that when you improve the neck, in terms of treatment with manual therapy, exercise, the patients start to improve the symptoms of migraine. And there is association, studies that show you that example, there is as a concomitant symptoms for migraine, is more common to have neck pain than vomiting, example. So the neck region is particularly important for migraine, and is not clinically so clear division between migraine and tensional headache. Most of the patients have like both type of primary headaches together. And when you improve the neck, you improve most of the time the migraine. Even if so this is the work like for the patient like a magic, because they've been to the neurologist, they took many medications without improvement, then they come to you, or no, another hospital, you do some movement, limitation of the neck, treat the neck, oh, the migraine maybe it was 5 times a week, now it's just 1 time every 2 weeks. So there's huge improvement. But what you have to know from another therapy that you have to balance very well the area of the neck, because if you treat only one side, you can make it worse. Y sé que básicamente que en los últimos años tenemos mucha investigación que te muestra que la migraña también tiene una asociación con el dolor cervical, la cefalea tensiva, miotensiva. Y clínicamente cuando se mejora el rango de movimiento del cuello y todo más, se mejora también la migraña. Y es importante para nosotros que se balance muy bien el cuello. Point number 2.
Sí. Antes has mencionado movilidad
También, sí, sí. El tipo mandibular también tiene mucha asociación con. Point number 2 is almost the same line over the frontalis muscle, more or less. A way to find you could do like this. More or less the last wrinkle of the frontalis, so almost at the end of the frontalis muscle. We used to say in Italy where this is the hairline, but the hairline in the man changed after the point is still here, okay? So usually same line or a little bit more lateral. Here the densification is very, very little because the frontalis muscle are very, very tiny. So you have to check more an area where there is less gliding. You will not feel here the feeling. It's more like a little fiber, a little area where the tissue is more stuck together. One way to check, you can use your thumbs and just check in this area the gliding. Usually you feel one area is more dense. When you find it, you can go with an apple as well. And usually the patient complain about pain in the forehead, or also pain that relates to the eyes. The main indication is again here, migraine, headache, and also sinusitis, especially felt in the frontalis sinus.